Good evening, everyone, and welcome to the ACHS Virtual Awards Ceremony 2021. My name is Dr. Karen Luxford, and I'm the CEO of ACHS and ACHS International. Firstly, I want to acknowledge the traditional custodians of the land on which we all gather today, in my case, the Gadigal people of the Eora Nation, and pay my respects to elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples here today. In this unprecedented year, our virtual awards ceremony allows us to gather together online and recognise extraordinary achievements in 2021. Tonight, we are celebrating the announcement of the winners of the Quality Improvement Awards 2021 and the ACHS Medal winner for 2021, as well as this year's launch of the edition of the Australasian Clinical Indicator Report ACER. And we have a very special guest speaker for you. We trust that you will enjoy this format and congratulate the winners we will announce this evening. I also wish to acknowledge the 3 panels of judges for our QI Awards who have generously given their time to evaluate and judge the many entries we received this year. Everyone working in healthcare who continues to support the many strong contributions towards improvement in quality and safety through their entries in this year's QI Awards. Our ACHS assessors for their professional efforts in assessing healthcare services against the safety and quality standards, and our committed ACHS staff team who strive to ensure that we inspire excellence in healthcare and continue to evolve. Welcome to everyone who is joining us around Australia and overseas, and if you're tweeting tonight, please use the hashtag Quality Improvement. It gives me great pleasure now to extend a warm welcome to Professor Len Notaras AO, President and Chair of the Board of ACHS Directors.
Thank you, Karen, and good evening, everyone. My name's Len Notaras, and as the President of the Australian Council on Healthcare Standards, that's ACHS, it gives me enormous pleasure to formally welcome you to our ACHS Virtual Awards Ceremony 2021. On behalf of my fellow directors and councillors, I'm delighted that you've joined us this evening to celebrate some of our achievements over the last year. It's been another year of changes and challenges, adapting to ongoing change. This is especially true for healthcare workers who continue to be at the centre of managing our response to the pandemic and are key to our future as we adapt to what might be the new normal. Their sustained commitment has been inspirational, and we acknowledge their ongoing efforts tonight. This is at the heart of tonight's celebration, acknowledging the successful achievements of others through the 2021 Quality Improvement Awards and indeed our prestigious ACHS medal. I'm very pleased to also formally launch the Australasian Clinical Indicator Report 2013 through 2020, the 22nd edition, otherwise known as ACER. We have now been collecting valuable clinical data and information for 22 years and are proud to have the longest standing collection of such data in the entire world. We are proud of this invaluable asset which continues to build ACHS as esteemed reputation and purpose every year. It is the most statistically detailed report of its kind and one of ACHS's strongest credentials as an authoritative healthcare quality improvement organisation. I'm therefore delighted to launch ACER, and it will be available a little later this evening on our website, that is www.achs.org.au. I'll now hand back to Karen, who will be presenting the Quality Improvement Awards. Thank you, Karen.
Thank you, Len. There is a lot of anticipation about this announcement as we received a very high level of entries this year. I'm delighted to announce this year's winners, but before I do, I would like to firstly acknowledge once more the magnificent efforts of our 3 panels of judges who made the tough and final decisions. Thank you for your superb work. This year, ACHS celebrates the 24th year of the annual ACHS Quality Improvement Awards. Our awards program continues to be very popular with healthcare organisations both in Australia and internationally. The awards program recognises and encourages outstanding quality improvement activities, programs and strategies implemented in healthcare organisations. The awards are presented in 3 categories: clinical excellence and patient safety, non-clinical service delivery, and healthcare measurement. For the 3rd year, ACHS also awards the Global Quality Improvement Award. The Global Quality Improvement Award is selected from the 3 existing award categories and recognises organisations using Australian healthcare standards to strengthen quality improvement frameworks internationally. Firstly, we will list the highly commended recognitions and then announce the winning organisation. A highly commended certificate was awarded in the Clinical Excellence and Patient Safety category to the following organisations: the winner of the ACHS Clinical Excellence and Patient Safety Award is Illawarra Shoalhaven Local Health District, New South Wales, for their submission Safer, Better Emergency Nursing Care for the Illawarra Shoalhaven Local District with HIRADE, a proven, upscalable emergency nursing framework.
This project is the culmination of years of work from a huge number of people, and we are stoked to receive this award. It stems from wanting to ensure emergency nurses have an evidence base to their initial assessment and management. I'd like to thank my clinical and academic colleagues who have contributed their time, immense intellect and clinical expertise. In particular, Dr. Margaret Murphy, who conceived this model with me, Dr. Belinda Munro, Professor Marg Fry, Professor Julie Considine, Professor Ramon Shaban and Professor Prabhu Sivabalan. This project would not have been possible without the engagement and enthusiasm for research of the clinicians and leaders from the Illawarra Shoalhaven Local Health District, and the practical and financial support from the University of Sydney, the Agency for Clinical Innovation and the Australian College of Nursing ensure we could see it through. Thank you again for this award, we're stoked, and here is a short video about the project from the nurses who use HIRADE.
Emergency departments are hectic, it's hard work here.
Get some help in here. We love it.
We care for everyone, from those at the beginning of their lives to those at the end of their lives.
When patients and their families come to the emergency department, they are in crisis. It is really stressful for them. Our patients don't have a diagnosis, so what we do as emergency nurses is critical to keeping our patients safe.
Now, to help us get it right, we need a tool to help us do the following crucial things.
Ask our patient and families the right questions so we don't miss anything.
Start the right treatment while they're waiting to see a doctor.
And communicate with our awesome medical colleagues so we're all on the same page.
And now we do.
That tool is HIRADE. HIRADE Actions, the fundamentals of emergency nursing.
HIRADE was developed by
Emergency nurses
for
emergency nurses. Our study proved that when emergency nurses use HIRADE,
patients deteriorate 50% less because they get earlier and better treatment.
And nurses feel way more confident when escalating their concerns to the doctors.
Nurses document much better. 80% better, in fact.
Doctors get a better handover.
Nurses get reminded what they need to do in a hectic, crazy, busy environment.
Hospitals save millions of dollars a year.
Investment in this program, in all it is will result in significant improvements and cost savings.
HighRate makes so much sense that we're partnering with New South Wales Health and Australian healthcare leaders to take HighRate national, so that no matter what emergency department you go to, you get access to safe, evidence-based emergency nursing care.
A highly commended certificate was awarded in the non-clinical service delivery category to the following organisations. A special commendation certificate was awarded in the non-clinical service delivery category as an initiative to advance Aboriginal and Torres Strait Islander health outcomes and goes to We Help Ourselves, WHO's New South Wales, for their submission ACHS and ATCA Partnership Initiative, WHO's inaugural double accreditation, February 2021. The winner of the ACHS Non-Clinical Service Delivery Award is Liverpool Hospital, New South Wales, for their submission 12 Books for 12 Months, Enhancing Early Language and Literacy Environments.
Literacy is a critical skill, and developmentally vulnerable children are at significant risk of literacy failure, and in turn, poorer academic, employment and social emotional outcomes. The development of pre-literacy skills and complex oral language in the preschool years is vital for the development of strong literacy skills. Enter the 12 Books for 12 Months.
A post-program analysis highlighted the importance of a second rollout, with some changes to address the intervals between resource delivery and using a pre-post survey design. Additionally, current research was indicating that resource provision alone might not achieve the significant child outcomes we were hoping for, and that Aboriginal children are at even greater risk for poor literacy and less likely to attend early childhood services. Therefore, the third cycle saw the development of a culturally responsive resource centred on 6 Aboriginal books delivered over 12 weeks with accompanying educator coaching and a rigorous evaluation method.
12 Books was developed over several quality cycles and targeted centres that were rated as meeting or below on the national quality standards. The first cycle trialled a practical professional development evening for educators. The feedback from educators was overwhelmingly positive. However, only 12 attended from the 130 invited. 2 main issues with this approach were identified. The first was challenges in educators attending professional development, and the second was the realisation that one workshop was not going to be enough to change teaching practices. Therefore, the 12 Books project was designed to address these 2 issues. It consisted of 12 resource packs that included techniques, practical strategies, and training videos based on 12 strategically selected books. 100% of educators reported changing their teaching and book reading practices because of the resource.
We are monumentally excited to have received this award and want to extend a sincere thanks to all our collaborators and supporters. Specifically, we would like to thank Uniting Links to Early Learning, the AEDC Working Group, Mission Australia Communities for Children, and the Speech Pathology Department at Liverpool Hospital. We would also like to extend our heartfelt thanks to Garumbi Media for donating invaluable time and expertise in editing of all of the resource videos, and our Speech Pathology Manager for her unwavering support and encouragement throughout. Finally, we would like to thank ACHS for the award and recognising the innovation and success of the 12 Books project and the General Managers Unit and Clinical Governance Unit who encouraged, supported and approved the submission.
A highly commended certificate was awarded in the healthcare measurement category to the following organisations. A special commendation certificate was awarded in the healthcare measurement category as an initiative to advance Aboriginal and Torres Strait Islander health outcomes and goes to St John of God Healthcare WA for their submission, partnership with Djaling Wajiking Aboriginal Ear Health Program. The winner of the ACHS Healthcare Measurement Award is Prince of Wales Hospital, New South Wales, for their submission, Improving Access to Medication Review in High-Risk Inpatients.
Thank you to the ACHS for the award. My name is Carly and this is Adriana, and we're both senior pharmacists at Prince of Wales Hospital in Sydney. We started this piece of work in 2019 with the aim of ensuring access to medication reviews for high-risk inpatients. Our problem was that all of our inpatients meet the standard high-risk criteria, but we don't have enough pharmacists to see every patient. So who should be prioritised for medication reviews? We also knew that we had double the rate of medication-related hospital-acquired complications, or HACs, compared to our peer hospitals, and our pharmacists were stressed with the reactive way that we were working. We embarked on a clinical redesign journey to identify 4 major solutions to increase medication reviews. We used local indicators of harm to develop a matrix that identifies our highest risk patient population, and we prioritised those patients for review. We also restructured our pharmacy department to align us with medical specialties and introduced clinical lead pharmacists.
We developed learning packages to improve clinical documentation and instituted regular peer review of documentation. We established automatic reporting of processes in EMR, and we set up dashboards to monitor coded data. We observed a reduction in medication-related hospital-acquired complications by 25%. Pharmacist coded activity increased from 140 to 217 per 1,000 separations, and in the prioritized patient groups, this number nearly doubled from 200 to 400 per 1,000 separations that has been sustained. In the lower risk patient groups, we actually maintain the same level of activity. Thank you to the ACHS for the recognition and increasing the profile of the importance of medication safety and the role that pharmacists play in hospitals to improve patient care. Thank you to the Health District, Prince of Wales and Prince of Wales Pharmacy Department, and all the clinicians who contributed to the success of the project.
A highly commended certificate was awarded in the Global Quality Improvement category to the following organisations. For the first time, there were 2 joint winners of the Global Quality Improvement Award. They are Fresenius Medical Care Asia Pacific, Hong Kong SAR, for their submission, the implementation of an electronic auditing program across 10 countries.
Thank you so very much. On behalf of Fresenius Medical Care Asia Pacific Clinical Quality Team, I'm delighted to accept this prestigious award. There are a number of people I would like to thank, and firstly, I would like to thank the Australian Council for Healthcare Standards for this wonderful opportunity and their commitment to quality improvement and evidence-based practice. Thank you also to everyone involved in the project, including our Chief Medical Officer, Dr. Michael Eder, for his continued support and guidance, our clinical information colleagues for helping make this project a reality, the clinical quality team for their tireless efforts, but most of all, I would like to thank the hundreds of nursing staff for their commitment to quality improvement and who have successfully implemented the program across 290 dialysis centres. Fresenius Medical Care is the largest provider of dialysis care globally, and our project involved implementing an electronic auditing program across 10 countries in Asia Pacific. It included developing an application and web-based database for the staff to upload our quality audits and untake auditing on a handheld device. The project has facilitated the identification of service gaps, compliance monitoring, and improving the quality of care for patients.
Key to the program's success was consultation with country teams to ensure the specific country needs were met, such as multi-language support. The program has offered more than just auditing to identify gaps, but the opportunity to use the audit data for strategic planning, guiding business objectives such as appropriate healthcare and financial planning through priority areas. It has also recognized areas of conformity and strength within our services, leading to the best practice sharing across countries, leading to safer and improved services for patients and staff. Thank you.
And the other joint winner is Hong Kong Baptist Hospital, Hong Kong SAR, for their submission key to combat COVID-19 in Hong Kong Baptist Hospital, agility, dedication and passionate support from all staff levels.
Thank you, ACHS.
We are delighted and honoured to receive the ACHS Global Quality Improvement Award 2021. I'm Grace Wong, the General Manager of Hong Kong Baptist Hospital.
I'm Dr. Tony Ng, Consultant Microbiologist.
I'm Dr. Patrick Lau, Infection Control Officer.
I'm Cindy Wong, Infection Control Nursing Officer.
I'm Catherine Yip, Manager of Procurement and Supplies.
I'm Dr. Alex Yu, Chief Executive Officer of Hong Kong Baptist Hospital. We're delighted and excited in winning the ACHS Global Quality Improvement Award 2021 regarding our exemplary measures against COVID. Our paper is titled Key to Combat COVID-19 in Hong Kong Baptist Hospital: Agility, Dedication, and Passionate Support from all staff levels. We set up hospital command team to take the lead in planning and monitoring the implementation of various measures in protecting the hospital, staff, and patients. The measures include on clinical side, like clinical triage, isolation, and various COVID screening tests and clinical protocols in diagnosis. With our committed staff force and courage to innovate, we even set up our own surgical mask production line in the midst of COVID outbreak. Hong Kong Baptist Hospital is even the first hospital in Hong Kong in using robots to disinfect and clean the environment. With the efficient and effective measures executed diligently by our staff, Hong Kong Baptist Hospital is successful in achieving zero hospital-acquired infection. We cannot make it without strong teamwork and commitment to overcome. We are thrilled to share our learnings in difficult, quality and safe journey with our counterparts in Hong Kong and other side of the world. Thank you once again to ACHS for the award, which is an excellent recognition on the efforts and contributions of our staff. Last but not the least, we are grateful for the great support by our board directors and associate doctors.
All of these submissions are included in the Quality Initiatives publication that can be viewed on the ACHS website. Thank you everyone, and I'm delighted to hand back to Professor Nataras to present the ACHS Medal 2021.
Thank you so much, Karen. Each year I have the great honour of presenting the ACHS Gold Medal. Now in its 37th year, the award of the prestigious Gold Medal provides an invaluable spotlight on recognising personal performance in health's safety and quality arena. The award recognises an individual's outstanding contribution promoting safety and quality in Australia's healthcare services and is ACHS's highest recognition. Tonight, I'm very pleased to announce that the 2021 recipient of the ACHS Gold Medal is none other than Christine G. Our heartfelt congratulations, Christine, on this award, and I'll now read the citation that accompanies the medal. Christine G's contribution to the safety and quality agenda in healthcare, with a particular focus on the private sector, is impressive. Christine has not only had a direct impact as a leader, but also committed time, energy, and her intellect to promoting safety and quality in healthcare on a national level and over 25 years. Her contributions have been felt across the entire health system, with national leadership positions including a member of Australia's Council on Safety and Quality in Healthcare, a commissioner and board member of the Australian Commission since its inception, and a former ACHS counsellor. Along with numerous positions as chair of committees or advisory groups, Christine has twice been president of Australia's Private Hospital Association and chair of their Safety and Quality Task Force. As chair of the Private Hospital Health Industry Safety and Quality Committee, Christine led the development of the private sector quality criteria, which were subsumed into the existing accreditation standards. In this role, Christine oversaw a successful national trial of drug use indicators in private hospitals and day facilities. Following the establishment of the Australian Commission, Christine successfully advocated for the creation of the Private Hospital Sector Committee, PHSC, providing a bridge between the Commission and the private sector. This committee has been instrumental in building the Commission's understanding of the differences that exist between the public and private sectors, ensuring its work in standard development has been fit for purpose. Christine was responsible for ensuring the alignment of the Commission's standards with the national standards for mental health services and developing standards regarding recognition and response to mental health deterioration in acute care settings. She has been a strong advocate of the private hospital sector, leading the way in adopting safety and quality practice, advocating for amendments to APHA's contribution and making accreditation a condition of membership years before they became mandatory. Christine's personal philosophy has always been patients at the centre of care, and this is reflected in her work. Congratulations, Christine, on your many achievements and being the deserving winner of this year's ACHS Gold Medal. Christine, it gives me great pleasure to virtually present this award to you, and while we're not together this evening in the same room, it is a great privilege that we have. It is sent with our very best wishes, and I'd like again to congratulate you. A deserving job well done. You have made, Christine, a significant difference. Thank you.
Thank you, Len, and thank you to the ACHS board for the incredible honour of being awarded the ACHS 2021 medal. To follow such a long line of distinguished recipients is truly overwhelming. I would like to acknowledge the ACHS for their dedication to inspiring excellence in healthcare and for their long-standing commitment to recognising and celebrating quality improvement. Karen, you lead an exceptional organisation. Congratulations to this year's award winners. You serve as an inspiration and encourage us all to strive for patient-focused quality improvements. Whilst the pandemic continues to provide many challenges, and at an event that celebrates excellence in healthcare, I can think of no more fitting an occasion to express deep and profound respect to all healthcare workers. First and foremost, I commend all at Toowong Private Hospital for their commitment to excellence in psychiatric care. In September, I celebrated 25 years as the hospital's CEO. Across that time, I have witnessed with great pride and admiration teamwork at its finest, and never more so than throughout this pandemic. I have been humbled by the displays of resilience and courage, and awestruck by the empathy and devotion of our staff and doctors to ensure that our patients have continued to receive the best possible care throughout some incredibly difficult times. I have the great fortune to have a career that I absolutely love, and am privileged by the opportunity to work alongside many talented individuals across a range of organisations, all consumer-focused and all with the aim of improving healthcare. The Australian Private Hospitals Association has a strong commitment to ensuring Australia's balanced healthcare system remains balanced. Promoting the engagement and inclusion of private hospitals as the significant providers they are is vital. Thank you to Michael Roth, Lucy Cheetham, and all involved with APHA. Thank you to AHPRA and the Medical Board of Australia for the leading initiative in transforming the regulatory management of sexual boundary notifications. To my fellow board members and to the AHPRA personnel who support the National Special Issues Committee, thank you for your commitment and expertise that drives forward this very important work. Thank you to the AIHW, The genius that has been built over 30 years of experience working with health and welfare data is outstanding. Relevant data is a must to make evidence-based decisions and support the delivery of safe and quality healthcare. Thank you to Deb Piccone and the Australian Commission on Safety and Quality in Healthcare. I am exceptionally privileged to have been involved on the board and across several program areas over many years now. Chairing the Mental Health Advisory Group and working with Sue Ellen Allen, Andrew Moores, and those at the forefront of mental health services and lived experience across this country is both a highlight and profoundly rewarding. I am passionate about patient safety reporting, so it is an honour to co-chair this area for the Commission with David Philby. Together with Catherine Katz and her team, we are dedicated to ensuring its success. Whilst there are some outstanding examples of public reporting, national safety reporting is one area we need to do much better in. It is not acceptable that in 2021, Australia does not have a public reporting system of safety and quality data that is aligned across public and private hospitals. We must fully embrace the reality that patients and consumers have the right to access meaningful patient safety reporting. Of course, ACHS provides an exemplar of the power of data. The quality improvements that have been driven by the collection, reporting and analysis of the ACHS Clinical Indicator Program are extraordinary. It is a cornerstone in safety and quality improvement within our healthcare system. It is incumbent on all of us who work in healthcare to do the best we possibly can for the patients who depend on us. Working together, we can achieve so much more for so many more. In closing, I would like to thank my children, Tom and Alexia, for being my inspiration in life and my stays. Thank you again, ACHS. This medal will be treasured.
This year, ACHSI, our international subsidiary, awarded the ACHS International Medal for 2021. This was announced back in August, and I'm pleased to acknowledge tonight there were 2 winners for this year's medal. One winner from the Asia Pacific and the other from the Middle East. The winners were Dr. Lalau Joseph from India and Dr. Jamalil Al-Salman from Bahrain. Congratulations both for winning the prestigious ACHSI International Medal 2021. It's now my enormous pleasure to welcome Laureate Professor Peter Doherty, AC, a distinguished Australian and immunologist after whom the Doherty Institute situated in Melbourne is named. Professor Doherty has worked in immunology research for 6 decades, and his global achievements are nothing short of outstanding and breathtaking. He shared the Nobel Prize in Physiology or Medicine in 1996 with his Swiss colleague for their discovery concerning the specificity of cell-mediated immune defence and the biological role of the major histocompatibility complex, MHC. As a national living treasure and former Australian of the Year, it gives me enormous pleasure to introduce Peter and to welcome him as our very special guest speaker this evening. Peter, we look forward to hearing more from you this evening, not only about your career, but some of your thoughts and reflections on the COVID pandemic from its very start to where we are today.
Good evening. So I'm going to say a few things about COVID-19, which I hope will be of interest. It's been an extraordinary experience, as we all understand. Not something that human beings are necessarily prepared for, though it's happened over and over through history. And that is that a tiny bit of genetic material in a virus that can't even move itself around and is an inert particle can jump across from another species somehow, we're not quite sure how, and infect us and disrupt the whole global economic, social system. So quite extraordinary when you think about it. And if we think we're the masters of the universe, perhaps we should rethink. So COVID-19, a coronavirus, it's a large RNA virus. Every other organism above the viruses is DNA for its nucleic acid, but viruses are both either RNA or DNA. This is a big one. It shares that with influenza, but it doesn't have the propensity of influenza to mutate at an extremely high rate. As we're all very aware, it does mutate. We do get variants, and those variants are different in their biological properties. They will grow faster. And in fact, the Delta strain we're dealing with currently is, to my mind, simply a virus that has mutated to grow faster and spread more. It isn't a virus that's mutated as an immune escape variant. This is what happens with influenza. With the much higher influenza mutation rate, we get immune escape variants that will escape from the antibody response, which is the primary response we stimulate with vaccination and following infection too. But this one so far hasn't done that. It's changed, but it's been changing. The Delta variant was first isolated back in December 2020 in India. So that was before much vaccine was out there. And so it's just, if you think of a runner analogy, it's an 800-meter runner that runs at the speed of a modern Olympic champion compared with a 1900 Olympic champion who would have been a gentleman from Oxford who'd been drinking all night the night before and then gone out on the track. So it's a much more sophisticated and faster virus. So we can't be sure, though, that immune escape variants won't happen. And if they do, we'll have to be revaccinating everybody, as we do with influenza every year. So I do believe that the Australian government has a lot of doses of Pfizer on order for the future, and that would be presumably where we would get such a vaccine at the present time. So COVID-19 came in quickly into Australia. The virus was we first knew about it from December 2019 in Wuhan. The virus sequence was published in mid-January. If you think of the 1918-19 influenza pandemic, the virus wasn't even isolated for another 13 years. But now modern science is extraordinary. We published the sequence within weeks. And the Chinese who had this, their hand was forced a bit by Eddie Holmes in Sydney, one of our leading virologists globally, in fact. And as soon as that was out, the vaccine manufacturers started to make vaccine because they knew the gene sequence they wanted. And both the vaccines we've used widely, the types, the mRNA vaccine and the AstraZeneca, in effect, deliver mRNA, the template for making protein, which is the structural material of our bodies and the virus, and is what the antibody responses are against. So both vaccines in different strategies deliver mRNA into our cells. They don't replicate, they don't infect other cells, they can't infect other people, they're completely non-dangerous, and they give us very good immune responses. So they started making those vaccines straight off, and they started to do, and we were also ready to diagnose our first case of COVID-19 in a visitor from Wuhan, who self-reported because he was aware of the problem. We diagnosed him with the PCR test, which became the standard test for use across our country, and we isolated the virus from him. One of the first, I think the first outside China perhaps, to isolate the virus. Not only that, as we gave it out worldwide, which is absolutely essential for quality control purposes in laboratories, for doing the virus neutralization test, which is the most sensitive test of immune response. The antibody binds to the virus, stops it infecting cells in culture. And also it's essential to do the virus challenge studies that you need in animals. When you give a vaccine, then you challenge them with virus. So the virus, giving it out worldwide, was a major contribution on our part. Now the vaccines, the immune response. The immune response to this virus can be very effective, and it can sometimes not work all that well. And we don't know as much as we would like to know about it. We do know, we get firstly, immunity is divided into two bits. There's what's called the innate immune response, which is a very, very rapid response mechanism. It's not the one we prime up with viruses. It makes all sorts of toxic molecules. We call them cytokines and chemokines and interferons in an attempt to get rid of the virus before the specific immune response, which takes another 6, 10, 12 days, really can turn on. Those toxic molecules can give us what we call the reactogenic effect of the vaccine, the sore arm, the fever, the headaches. That's these molecules getting into the blood and affecting our brains quite directly, in fact, and doing other things as well. The so-called adaptive immune response, the virus-specific one, starts to cut in about 6, 8, 10, 12 days after infection or after vaccination. After infection, the virus comes in through the nose. It grows first up here, and it can go down into the lung. Initially, while we were saying this is not influenza, we were thinking this is very like influenza. But that is partly true. It causes a pneumonia, it causes a respiratory disease, a horrible respiratory disease. But unlike influenza, which stays in the respiratory tract, the nose, the lung, all that part, this virus gets into the blood and goes around the body in our blood. So once a virus is in the blood, it can get to any of our main body organs. It can infect cells in the heart, the kidneys, maybe the brain, we're not quite sure. So it does a lot more damage. And also it causes what's called coagulopathy. It causes blood clots. It can cause big blood clots, little blood clots. And we know that there's a blood clot problem with the AstraZeneca vaccine, much worse with the virus than with the vaccine. So the vaccines were developed fast. They were developed by the ones that came to the fore quickly, were the ones that were developed by the big companies. And so big pharma may not be on the side of the angels always, but if you want to get something out fast, you enlist the strategies, the techniques, the resources of big pharmaceutical companies. And that's what was done. And by the end of that year, we were vaccinating people in the United States, United Kingdom. They'd been through phase 3 trials, and those vaccines were going generally into people in the United States in February of this year. They would have gone in earlier, except for the fiasco after the election, with Trump sort of totally losing focus. So basically, they're safe vaccines, they're effective vaccines. So when the virus gets in, it causes an immune response because in the tonsils and the adenoids, many of us don't have those of my generation, they were cut out, or in what we call the lymph nodes of the neck, the cervical lymph nodes. When people get the vaccine goes into the arm, it actually follows exactly the same path as tattoo ink. It goes right into the arm. Some of it goes into deltoid muscle, which is a big muscle here. And then it goes into little cells called dendritic cells, which drain in our other circulatory system. You know, we have the blood pumped by the heart. We also have the lymph, which is the great drain of the body, which drains the tissues back into the blood. And as it drains it, it goes through filter stations that we call lymph nodes. And that's where the immune response happens. And so when we inject that vaccine into the arm, it goes in the lymph down to the regional lymph nodes in our arm, the axillary lymph nodes, and that's where the immune response occurs. And actually, it doesn't really go much beyond that. You might find tiny bits in the blood. And so the immune response that people worry about so much, it's a pinprick in the arm, immune response here, stuff goes, and all the stuff that's in the vaccine is gone within a week or so. On the other hand, the guys that get tattoos, if they've got a black tattoo or a blue tattoo, they have blue lymph nodes for life, full of large lumps of crap, which God knows what it does in the long term. So that's the immune response. The immune response so far is handling the variant viruses like Delta quite well, though all the vaccines are made against the original strain. Alternative vaccines are being developed, and we may have to use them, we hope not. At the moment, boosting the present response gets the antibody levels, the antibodies circulating in blood that will stop the virus getting into cells, causing the infection. Those antibody levels, if we can keep them high, we're getting a really good level of protection. So we'll be seeing booster shots after 6 months. They're being approved at the moment. We're using them in the very vulnerable already, and then we'll be giving them to people like me who are over 60, and in my case, over 80. So basically, the immune response has been fantastic from the vaccine. infection does give a reasonably good protection. In both cases, you can get reinfected. And the reason for that is, while it's very hard to keep the antibodies, which are also inert molecules floating around in the blood, very easy to keep them at high levels in the blood and stop that bloodborne phase and stop the severe disease, it's very hard to keep them at high levels up here. And that's why people are getting breakthrough infections in the nose. And you can get rather unwell for a week or so if you're fully vaccinated, and you'll still get some growth up here, and you'll have a bit of fever, and you'll be snotty and unpleasant, and you may lose your taste and your sense of taste and smell due to the virus growing up there, but you won't get really sick. So booster shots, the more we keep the levels high, the more we stop any of that infection, and it really is a fantastic protection. And vaccines have proved to be an enormous success. Of course, sociologically, we've all seen what comes out of the woodwork with anti-vaccination people who don't understand, people deliberately spreading misinformation. And so once this is over, I think one of the tasks for all of us is to study this in the greatest depth, both from the point of view of what worked economically, what worked sociologically, what worked scientifically, and try to plan for this to happen again, because it could happen again. So we need to be prepared. So thank you very much.
Thank you so much, Peter, for your knowledge, your warmth, your humour, in sharing with us your thoughts on the pandemic and the future that we collectively face together. It's been an illuminating and inspiring talk. We're honoured to have had you join us, Peter, and we share with us your reflections on what has been a most confronting health dilemma for all of us. Thank you again for your time. We are delighted to have had your company this evening. I'd like to take this opportunity also to congratulate ACHSI CEO Karen Luxford for her outstanding leadership in such unpredictable and tumultuous times, as well her executive team and all members of the ACHS organisation. Not the least, Ali, who has ensured quietly that things happen. A sincere thanks to all from both myself and my fellow directors. I'll now hand back to you, Karen, and wrap up this evening. Thank you for joining us. It's been a true privilege and pleasure. Thank you.
Thank you, Len. It's been our privilege to have Professor Doherty speak to us this evening and share his thoughts on the pandemic. That concludes our second ACHS Virtual Awards ceremony, and I do hope you've both enjoyed yourself and learnt something new as we continue to work with you in improving quality and safety in healthcare. Thank you and good evening.